Now.
Thank you, Hayden. Good morning. How are
Morning.
you? It's a pleasure to meet you in person, Mr. Bencivenga.
Just call me Ralph.
Okay. Thank you. And Dr. Beth Scarborough is with us. She is the Assistant Professor of Palliative Medicine and the Associate Director of Ambulatory Services at Mount Sinai Medical Center. But we're going to start with talking with you, Ralph. Over the time that we've planned this session, I feel like I've gotten to know you and Patricia. And before we start talking about finances, I want to spend a few moments getting to know you and letting our audience know you, Patricia, and your role as a caregiver. So let's start with you. Tell me about yourself.
Okay, I'm a young 66-year-old cancer survivor. I have esophageal cancer that has been taken care of, and also a spot on my lung that has been burned away. So I'm in remission twice. Thank you, doctors. But I'm before that I was very healthy. Now I'm very healthy. I worked close to 40 years at Merrill Lynch and Company. Upon being terminated, I moved on to a law firm which worked another 6 years. So I have a lot of years experience. Also, a lot of years paying insurance premiums for medical insurance that is non-transferable. I don't want to get into that.
We'll get into that later.
In addition to that, I had 3 children, Jennifer, Michael, and Ralph Jr., all high achievers, all secondary degrees. One is an attorney, beg your pardon. Next one is a doctor of veterinary medicine, my Michael, who's also a major in the military, special forces. In addition to that, I have a son who is part of your organization. He works for Merck Pharmaceuticals, and he's doing a good job. He's making more money than all of them, so something in the medication. And that's about me. I'm again in good shape. I'm working hard. I'm studying still. Hope to live another 10 years.
So tell us about Patricia, your wife.
My wife, who recently passed June 29th. She got to be the young, she had 65 years old. She was in hospice every bit of 4 hours before she passed. Dr. Scarborough put her in a couple of years ago to hospice, and she wanted to be taken out, but going back, she was in for 4 hours. She was we were married for 40 years. 45 years. But I met her in 1967. Can you imagine that? And we got married 72, and we had the children. She was a stay-at-home mom. That's why we have successful children. But I don't want to go there either. In addition to that, she worked very hard bringing up children. When they went to college, when we needed extra funds, she also worked to try and bring in additional funds. Very shy woman, a woman who had a lot of problems with her shyness. It brought her to a lot of depression, a lot of rehabilitation, also going to different mental institutions for nervous breakdowns. They used to call them in those days, and electroshock therapy and all the hell that we went through with that. But she always seemed to survive that and come back.
And she was a great homemaker. Tell us about your home and what that's like.
We worked, and we stayed for 19 years before we purchased our first home. And she was fanatical with cleaning the house and preparing suppers and all Italian type of meals. Those meals are now, my son, who's a major in the military, is making a cookbook based on my wife's recipes. She's just phenomenal. Before I had my cancer issues, I was every bit of 200 pounds. Now I'm at 166 and growing.
So Ralph, was your home a one-story ranch or 2 stories? Give us a sense
This was
of that.
a 3-story home, which made things very difficult towards my wife, who had COPD, asthma, cancer, and just suffered enormously, emphysema as well. She couldn't do any of the steps and didn't want to go to hospice, and so we struggled with that.
So I know you and Patricia had a love story. Did you have ties with the community? Were you involved with a faith community or other organizations?
For sure. I was a lector at a parish in Brooklyn for about 10 years. A lector reads from the Bible and has to be very, very clear in his speaking. And I used that as a presentation skills to work at Merrill Lynch. But it also helped me get close to the Bible and the community. I worked as a kind of committee man in Knights with Columbus.
Okay. And not to get into all of her medical issues, but can you talk about what it was like to be a caregiver for Patricia?
I had to write down all the things that caregivers do. And a lot of you people know it that have two jobs and just have difficulty getting the family together. But I had, you know, the actual preparing meals, which I'm horrible at. Had to start learning that. Also, grocery shopping, banking, yard taking care of that, laundry, ironing. I never ironed in my life until she got sick, and I had to do a lot of ironing. So it was really, really difficult to do those things, and then also to take care of her, babysit for her, change her diapers. I mean, it was just very, very difficult at times.
It must have been incredibly hard for you.
Yes, yes, it was.
And we're going to talk now to Dr. Scarborough about Patricia's medical problems as well as your own, and then we're going to get back to you in terms of this caregiver role and some of the impact of the financing that it's had during that time and as we look forward.
Thank you.
Beth?
Absolutely. So I was the palliative care physician for Patricia and have also been the palliative care physician for Ralph for the past few years. So I got to know both of them in their roles as patients, but also as caregivers. So Ralph, starting with his medical history, he was originally diagnosed with esophageal cancer in 2012, and he received chemotherapy and radiation at that time. After several months of chemotherapy, he was at a point where he could have his tumor resected. So in February of 2013, he underwent a resection of that tumor, and he, at that point, had no evidence of cancer in the body. So from February of 2013 through September of 2014, every time his oncologist did a scan, the scan showed no evidence of cancer. In September of 2014, he had a lung nodule that showed up on one of his scans that was biopsied and shown to be metastatic esophageal cancer. So at that time, in the fall of 2014, he resumed treatment with chemotherapy. And what's important to know about Ralph is that even prior to his chemotherapy, he had long-standing peripheral neuropathy in his feet. So he has a painful sensation in his feet that can make it difficult for him to ambulate normally and to do basic things, including going up and down the steps to take care of Patricia. And the chemotherapy that he got in the fall of 2014 significantly worsened that neuropathy. So he received chemotherapy up until about February, March of 2015, when he got additional radiation to the metastatic lesion in his lung. And from March of 2015 to date, his scans have shown that his cancer is in remission and have not shown active disease.
So that's terrific news, isn't it, Ralph? It's great. It's great. So maybe we'll get a better sense now of Patricia's illness, and then we'll go from there.
Yeah. So Patricia's first contact with the hospital where I work was in the spring of 2016. She had long-standing COPD, and one of the scans that she had done in March of 2016 showed lung nodules. And it wasn't clear from that scan if those nodules were old from an old infection or inflammation, or if they were cancerous. So she had a PET scan that looks at the entire body for areas of cancer, and it showed that the lung nodules were actually not cancerous, but it did show a tumor in her colon. So she was evaluated by a surgical oncologist at Mount Sinai, Dr. Labo, and he said, I can do this resection, I can cure you of the cancer, but I'm concerned that you won't come off the ventilator because of the severity of the COPD. And he said, in fact, you may need 2 surgeries, one to resect the tumor and then a second surgery months later in the event that you have an ostomy, and that would have to be reversed. So there's a two-step process.
That must have been a hard decision-making process for Patricia and for you as well, Ralph.
Yes, it was.
Yeah. So Dr. Labo started some of that conversation about, would you want to go through with a surgery if what you're faced with is potentially being on a ventilator for the rest of your life, and referred her to me to help facilitate some of those conversations. And at the time when she came to me, so this was the spring of 2016, she had severe COPD. So one of the ways that we measure the severity of COPD is by how breathless someone is. And she was able to rank on a severity score that at that point, she was too breathless to leave the house, and she was breathless when getting dressed, which is the most severe degree of breathlessness that someone can have. And she's, we had a conversation about what was important to her, and she really didn't want to go through with a surgery. And she subsequently decided to enroll on hospice, and then a few months later kind of had second thoughts and said, maybe I'll give this a shot. So she actually had the tumor resected in the summer of 2016, went to rehab for a few weeks afterwards, which is not unexpected. But over the course of the next year, she had repeated admissions to other hospitals for COPD exacerbations. And during this time, I'm seeing Ralph every month because I'm still trying to adjust his pain medications now that he's off chemotherapy and his pain was decreasing back to where it was before. And every time Ralph comes in, he's telling me that Patricia's in the hospital. Now she's in rehab. She was home for 2 days. She's back to rehab.
So you didn't have a chance to get to see her for those periods
No,
of time.
so I didn't see her at all from 2016. And then in this past summer, what Ralph was telling me about what was going on sounded worse. And Patricia was scheduled to come back and see her surgeon the following week. And I said, would it be helpful if we sat down and had a conversation about how things are going? Because it sounded like things were becoming really difficult for him as a caregiver and for Patricia as a person. And I said, it sounds like we're really at a point where she can be reevaluated for hospice for the COPD. And we set that up for the following week, and she didn't come in for the appointment. And I called Ralph, and he said, she can't leave the house. She's too sick to leave the house. And I said, well, I haven't seen her in a year. I can't really do her hospice certification without seeing her, but we can get hospice to the home, which they subsequently did. And as Ralph said, she unfortunately died the same day that she ended up enrolling.
It might be helpful, since you didn't see her, just to really talk a little bit, Ralph, about what it was like as a caregiver beyond what you shared with us earlier. How difficult was it with your wife going in and out of the hospital? And tell us how she was deteriorating from your vantage point.
It was a point where she was very proud, a proud woman, and married 40 years. She wouldn't get dressed in front of me. This is the kind of woman she was. And now I have to go change her diapers, and she would just sit there and cry, and I would excuse me. And I would tell her, look, I did this for my father. We have to do this, and we have to clean you up, and everything will be okay. I mean, I'm not gonna. What can I do? I'm not dealing with a baby. I'm dealing with someone who I love and who I continue loving. And she took it from there. But it was extremely difficult because, besides making meals, I had to give her something nutritious and then feed her, and then she would just drop the stuff all over the place because she was unable to really coordinate herself. So it was almost like taking care of a child. I have 6 grandchildren, and I babysit and I took care of them, and it's almost like that was my 7th grandchild, and then that's the way I handled it, Pat.
And you had a 3-story home, and you were struggling with this nerve pain. What was that like in terms of caring?
I thank God Dr. Scarborough would make me, at least with the pain medication, functional. There was always an issue with, addiction and things of that nature. And I would tell her, I'm 65 years old, and I'm not going to get addicted. I'm not. Please don't worry about that. Just keep me functional. And Dr. Scarborough will go up and down and give me 20 less of this, give me more of this. I'm going to take you off this. And I'm like, oh, I just want to kill myself. This is incredible. And she brought me around to the fact that I needed to watch myself, but more importantly, keep seeing her once a month so that I don't get addicted. But going up and down the steps were incredibly difficult because each time when you walk with your plantar fasciitis and the rest of this stuff, it becomes very, very difficult, very hardening. So you're anxious to take another medication, but you hold off because you understand.
And Beth, it must have been challenging for you. There's value in taking care of both Patricia and Ralph, but also there are challenges trying to balance both their needs. Can you talk to us about that?
Yeah, I mean, I think it was always really challenging knowing how much of the physical work Ralph needed to do to take care of Patricia and trying to balance that with, you know, treating a type of pain syndrome that's really challenging and will really never go away, and trying to balance side effects of medications with pain control and keeping someone functional enough to, you know, to work and to do what's important to him. So I could see both sides of the coin in the same, you know, in the two patients.
And it must have also been hard when she was getting admitted to other systems where you weren't able to see the progression of her illness.
Yeah, I mean,
except through Ralph's eyes.
Right, and I think that's always very challenging because laying eyes on someone is priceless, and being able to talk to them and to evaluate exactly what's going on and how someone's feeling. And it is hard to get a sense for, you know, where is she on that trajectory? Because we know that there are ups and downs with an illness like COPD, and we never know when someone is going to have difficulty recovering from an admission. But it's hard to know where they are in that pattern without laying eyes on the person or being able to talk to them.
So I think we've really been able to see you and Patricia as people and get a sense of all of the medical conditions. How did it impact you in terms of the finances? And can you begin to talk a little bit about where things were in terms of the cost of the care, particularly with Patricia going in and out of hospitals, the rehab that she needed after the surgery? Begin to tell us about that. I know you have so much to say, but let's get started.
I worked Merrill Lynch, and at that time, before I was terminated, you know, they took care of almost 100% of all hospital bills, and because I was an executive, they even went further to that point where I would get X amount of dollars from bonuses based on my performance, but they would help pay for a lot of the other costs that were getting hit with me. When I lost my job and then went on to Cobra, I was paying an extraordinary amount of money, maybe $1,600 to $2,000 a month in the same type of insurance. And that was a really, really difficult bill. It was like another mortgage. So I was paying it because I figured, I'll get another job. Well, 4 years later, I didn't get another job. I never got another job. And I struggled, and it was a struggle. So what did I do? Some of the co-pays were $300, $400 in the hospital. $400 a day. I'm like, I thought co-pays were like $20, $40, $30. No, you got to pay X amount of dollars for the first 20 days. And I'm like, oh my God, it's gonna really wipe me out. So I said, you know, I'm not gonna complain about it. I'm just gonna use a lot of my 401k or those dollars I put aside for the rainy days or the golden years. It turned out to be really no golden years at all. Turns out that I paid a tremendous amount of money using my home equity. Maybe at one point it was up to $110,000 before I realized I wasn't getting another job and there's something I have to do. But anytime I applied for any kind of insurance or any kind of feedback or any kind of dollars, they said, no, you make too much money or you have too much money. I said, okay, I'll just have to wipe myself out until I'm able to get the full coverage that I have to take now, because now I lost my job and now I get sick and now my wife is sick. So I'm like, oh my God, you know, the Italians call it malocchias. They put the malocchias on me. Whoever did that really gave me some really bad, evil thoughts, because I couldn't believe that was happening to me all at once. But it did happen and I had to deal with it. But at the same time, I realized that you either paid the bills or you didn't get the care. Mount Sinai was great. You know, they put me on a pay schedule, but there was rehabilitation centers where she went, and I I was in the hospital at the time. I didn't get approval for her to go in, and she was there like 40 days. Well, now I got a bill for $30,000 that I had to pay now, them $200 a month, because I don't have the $30,000 to give them a write-off. And so I had to do that because my attorney, hell that he is, he failed me. And he said, okay, it was non-payment. I said, but I didn't have any, I struggled. I wasn't even available for this. What do you mean? Can't you fight this? No, we'll lose. I said, okay. So now I got another bill with them. Yeah.
But you know you're not the person that approves rehab. You know that.
I know, but this is what they tell me. You didn't get approval. So I said, but I didn't get approval. Isn't that grounds for not payment? They said, no, you have to pay. Or now, even if you die, we're going to take it in your home because we're putting a lien against your home. So no matter which way, they got me coming or going.
So Beth, this also impacted how you were able to make decisions about Ralph, because he was really using his current assets going into his future assets. How did that impact the care that you were providing Ralph?
I mean, I think one of the things is that there are therapies that could potentially be helpful to Ralph in managing his neuropathy, which are not covered by insurance. So in thinking about whether he could use acupuncture or some other non-pharmaceutical ways of trying to treat this neuropathy, those things are not covered. And at least in the New York metropolitan area, that could run $300 a week out of pocket for those treatments. The cost of his prescription medications alone, even though they've been brought down significantly from when he was at his worst during the chemotherapy in 2014, but the cost for those medications would run close to $2,000 a month if he didn't have any prescription coverage. And the other thing that always was challenging was knowing that there's no coverage for him to get additional help in the home and caring for Patricia, right? So Patricia didn't have an official sort of skilled nursing need. And without that, there was no ability to get somebody into the home to help with things without having to have the family privately hire someone, for as many hours as they can afford, which is really exorbitant and just not possible for many families.
So there's 2 points there. In addition to trying to manage the medications for Ralph, Patricia herself had many medications to control her COPD. Correct, Ralph?
Yes, she had an enormous amount of different prescriptions and medications.
It must have been tough to say, I don't have enough assets here. I know you did it out of love for Patricia, but how was it trying to go into that 401k, which was your nest egg for the future?
Well, there were penalties involved there, and maybe 20-30% of your funds would be depleted because it would be too early or it would be too much. So I just told my broker, do whatever you can to get me the funds in my checking account so that I can pay some of the bills, and that we'd be in better shape.
Mm-hmm. And Beth, in terms of the home care, unfortunately you weren't involved with Patricia's care at that point in time. Ralph, did the doctors at the hospital, when Patricia was leaving, offer to help get any other support for you? Because you were struggling as a caregiver taking care of Patricia.
They would always give you a social worker to call. And it was almost like a moot point. Okay, I call the social worker and ask for help, and I would just get maybe 3 or 4 hours a week. Somebody comes to the house, check her. Visiting nurses would come and check her, but helping out at the house is almost impossible, or never happened.
And when they did come, what did you see in terms of what they were able to do and what your needs were?
They would come and say, okay, we're going to take care of Patricia. Well, can't you do like vacuuming? No, we don't do cleaning. Well, can't you, no, we can't do this. Oh, can't you make something? No, we can't do that. All we do is take care of Patricia. So, okay, so you really sit there and watch television with her as a babysitter. And that's practically what they did, Pat.
Mm-hmm. And so it didn't make sense to take out more money out of your 401k or put more on the home equity loan to try to hire private aides to help in addition.
Prohibitively expensive to do that.
Mm-hmm. And I know one of the other things we talked about was trying to get Patricia to see Beth, and what a struggle it was over that year. So can you talk a bit about that and some of the transportation costs?
Yeah, I went to many places to ask for help, like Access-A-Ride and things like that. And it's almost like you had to be in a wheelchair yourself to get any help. Because Patricia was really not even ambulatory at this point, it was very difficult for me to get her to Mount Sinai. But even for myself, car service from Staten Island, New York, not Astor Place, New York, but Staten Island, New York, to there is over $100 in a taxi fare.
One way.
One way, and it's ridiculous. And you go on the subway, you have to walk another 5 blocks, huge New York City blocks, to get to a subway. And the subway is really like a jungle. In that hour, I don't know how you do it, doctor. It's very difficult. But nonetheless, it's prohibitively expensive, very expensive, and also dangerous.
And more than that, with your nerve pain, you wouldn't have been able to do those long city blocks.
Right. Even if I want to drive, sometimes my foot will fall asleep. So I don't know if I'm going fast or slow at this point. And to watch things on the road is very difficult in New York City.
Did you see any options for transportation for Ralph when he was coming in?
No, I mean, I think it's really challenging. It's extremely expensive. It takes him hours, to come in for a visit, is several hours each way because of Access-A-Ride. And there are not really other good options for being able to make that less time-consuming or less costly.
It also speaks to the value of more home visits, the old-fashioned home visits, and community-based palliative care.
Right, and those things are very difficult to figure out how to pay for and how to structure. And we don't currently have that kind of infrastructure in place to be able to do that. There was a time when before Ralph was quite as sick as he had been with his initial diagnosis, where I had his medication stabilized enough that I worked with his primary care doctor to be able to have him go and see her a little bit more regularly and me less regularly to cut down on some of those costs. But in the last year or so, he hasn't really been stable enough to be able to have these medications prescribed or adjusted by a primary care physician.
And at the end of the day, for someone like Patricia, there isn't a way to get her in. And so I think our challenge is to develop systems that are built around the needs of someone like Patricia and yourself, Ralph. So let's talk a little bit about food. That was another issue. How did you said you were never a really good cook, never could meet Patricia's standards, but did you try Meals on Wheels or other ways to provide food for Patricia?
Yes, and because she was such a stickler for eating, she would take the apple, eat the apple, but the rest of the stuff she would dispose of. And after a week, I said, you can't be doing this. I mean, they asked for a donation, but I don't want to waste food or waste money. It's not right. Other people might be more needy. So I told them to stop delivering it. Then I went to Dr. Scarborough, who introduced me to God's Help We Deliver. And they were a notch above Meals on Wheels, but again, they didn't really deliver what maybe God would eat, but I didn't. Maybe what would God eat? I read that the other day. Something. But I didn't. She again didn't like any of that, and I couldn't eat both sandwiches or dinners. So we stopped that as well after 2 weeks, and couldn't do it.
So as Patricia was going back and forth in the hospital, did any of the physicians talk to you about the fact that as she was getting sicker, her appetite might not be at the same level that was normal?
I never really was told by any of the physicians if how she would react or what she would react. All they would say is, she has a better quality of life just being home and you giving her soups and things like this, but nothing.
Did anyone really talk to you about where things were going because she was going in and out of the hospital? Did anyone have a honest conversation with you about that?
Pat, I got to tell you, I thought that I would have her for another couple of years. When I took her out of the hospital in June, they said, "Oh, go home and everything's okay." But everything wasn't okay. I was yelling at her because I thought she was just being lazy. Members of the family said she was spoiled. You spoiled her. You were, I don't know what they call me, a provider or whatever they would call her, an enabler. And I'm like, okay. So I'm fighting with her now, and the poor woman is dying. And I didn't realize that. And that's why I just feel terrible the last couple of weeks where I was really difficult with her, but I thought she was being lazy. I didn't know that she was dying.
Would it have helped if someone had an honest conversation about that?
I would have exhausted all my funds to give her a better life towards the end, for sure.
Or get her back into hospice sooner.
Yes, sooner, yes. As Dr. Scarborough had recommended, years ahead of that.
Yeah. So at this point, you've exhausted a lot of your finances. What does this mean for you for the future?
Like I said, the golden years are very, very difficult. I've taken a small job to try and keep myself busy, but more importantly is I get some additional funds to take care of my bills. And I got to tell all you guys who might have children, they told me, "Oh, we're going to spoil you, Dad, and it's your time to be spoiled. And we're going to send you money." Well, that's been 6 years, and I haven't seen a check yet. So forget it. It ain't happening. They have other obligations. They have children to take care of, and I'm sure that they'll take care of my funeral.
So since you raised the issue of your children, did your children help you with any of these tasks during that last year when Patricia was in and out of the hospital in terms of shopping or cooking or cleaning?
CD zeros here? 000? That's what I got. 000. No help, no guidance, maybe a couple of phone calls. Is everybody still alive? Yeah, okay, have a nice day. No help.
And I think that's because people are so busy, as you said just before, between their children and grandchildren.
Correct.
But is that the way you expected it?
It's not the way I was brought up. My siblings, we took care of my mother and father until they died.
Well, you said that you took care of your dad, and that's why you felt that you were able to take care of Patricia and do for her, in spite of all of what you were going through yourself.
Generations, I believe, are changing. I know there's a lot of good people, there's a lot of good young folks, but they don't have the same obligation or the same respect that we had for our parents. Mm-hmm. It's just not there.
Yeah. But Beth, what else might you want to add in terms of the impact of the financing, in terms of how you were able to care for both Ralph and Patricia?
I think one of the things that was incredibly difficult was feeling a little bit helpless as a clinician, knowing that there were things that they both needed as patients and as caregivers, and not having a way to help provide that. You know, we have pills to fix a lot of things, but we don't have a pill for caregiving and for help with, you know, the day-to-day things that can help control symptoms at home, can help reduce caregiver burden, and can help keep people out of the hospital if the hospital is not where they want to be or where, you know, they need to be, if their medical care can be provided in the home. And I think it's really challenging to have the kind of health infrastructure that we have in this country and still see all the innumerable places that people fall through the cracks because no one is helping people outside of the hospital setting.
Well, our current financing and payment system is really focused on the medical. It's on those hospitalizations that Patricia had. It's also on the medications, but it's not on what you clearly needed to help take care of Patricia and what you needed to be able to bring your expertise into the home. Another question is, you talked about your children. What about the community or the Knights of Columbus? You were very engaged with the community. Did you have any help from the community?
Maybe I was a bit proud to do that. You know, at a certain point in your life, I don't want to beg, or and it's a form of begging. I just didn't want to do that. I didn't want to, subject myself to that. So I didn't ask anybody, and if they didn't see, then they're blind, or they put blinders on.
What I've always found is it's always hard. People will say, "How can I help you?" And it's not always easy to say, "This is what I could use."
Yeah, you're right. It's very difficult for everybody has their own issues and problems, and you can't expect anybody to give you anything or do anything for you, because they're busy with their own lives.
And as you point out, society has changed, and the needs of children and others are not the same as they were when you were caring for your parents.
Yeah, I believe they're good, wonderful children, and my children are wonderful, but you can't expect them to help with finance or doing anything, because again, they're in the military. Another person is just in the divorce stage, and another my daughter's working very hard because she has a high mortgage in a house she bought.
One other finance question, because your 401k was a bit of your nest egg on top of Social Security. You had to draw that down. You had those early fees. What percentage would you think is left?
I think now there's about 50%, and that's only because the market has been phenomenal for the last 6 months. Thank God. I mean, I can't stand Trump, but the market has just been phenomenal, and it's raised me about 20,000, 30,000.
And I would say that when we started having our conversations, it certainly wasn't at 50%.
No,
at all.
it was way down.
And it was at a point where you wondered what you would do in terms of augmenting Social Security.
Yeah, I even like the home equity, I have 150,000 that I owe. So even when I sell my home, I'm going to last maybe 6 months before I become destitute. It's ridiculous.
Yeah. At any point, did you think about filing bankruptcy?
No, I would never do that. My FICO score, believe it or not, is 833, because I pay all my bills all the time, every time, for the last 48 years.
You're my kind of man. So this has been wonderful having this conversation, and I think it has pointed out so much of what it has really shaped what we're going to be talking about for the next day, and what the roundtable members will be talking about tomorrow and in the future. Your story has really helped us to see what is reality, and when we look at you being a young 66, we know that we have an aging population. 10,000 baby boomers are aging in every day. We have so many individuals with serious illness and multiple chronic illnesses like COPD, like cancer, like heart disease, like dementia, and we have great needs in terms of changing our financing and payment system to meet the needs of folks like yourself and Patricia. And let's not forget neuropathy as a significant issue. And I think, as you have very well described, and Dr. Scarborough has added in, the needs of caregivers are great. And I think you well illustrated how our society is changing from women being primary caregivers and oftentimes daughters to not having that exist today because of so many other challenges that families are facing. So I think you've taught us a lot. I think about our aging population and so many others that are isolated, not only in their 60s, their 70s, 80s, 90s, and people in 100 plus who have similar needs to yours, even without serious illness. So we need to be able to move from focusing on purely the medical needs to addressing a lot of these very basic human needs to be able to allow folks to be able to stay in the home. I really appreciate your love for Patricia and what you were able to accomplish. but I am also sad that it has left you in a place where you won't experience your golden years in the same way that you had envisioned. But thank you for being with us today.
Thank you. Thank you for listening.